Good evening, friends. Hashtag breaking medical news update, July 17, 2026. Welcome to your ultimate daily rundown of the most critical breakthroughs, FDA approvals, and global health policies transforming medicine. Today features game-changing announcements in cardiology, oncology, pediatric health, and major structural changes in healthcare delivery. Here is your medical news briefing for July 17, 2026. Hashtag 1. Top story, FDA approves first ever oral PCSK9 inhibitor. The U.S. Food and Drug Administration, FDA, made history by approving Lifendra, enlicitide, developed by Merck Sharp and Dohme. Asterisk the breakthrough, this is the world's first once-daily oral tablet designed to inhibit the PCSK9 protein. Previously, blocking this protein required frequent, painful injections. Asterisk target audience, adults suffering from high bad cholesterol, LDL-C, and heterozygous familial hypercholesterolemia, HeFH. Asterisk clinical impact, clinical trials demonstrate that this macrocyclic peptide successfully mimics injection-based therapies, offering a non-invasive way to drastically lower the risk of major adverse cardiovascular events, MACE. Hashtag 2. Global breakthroughs in clinical studies. Hashtag DNA exercise asymmetrically rewires heart nerves. A fascinating study published in Autonomic Neuroscience reveals that exercise goes far beyond just strengthening heart muscle, it physically rewires the nervous system. Asterisk the discovery, after 10 weeks of aerobic training, subjects showed a fourfold increase in nerve cells in the right side cardiovascular nerve cluster, stellate ganglia, compared to the left. Asterisk why it matters, left side cells doubled in size while right side cells shrank slightly. This discovery helps cardiologists pinpoint exactly which side of the nervous system to target when treating arrhythmias and stress-induced broken heart syndrome. Hashtag stethoscope reversing severe fatty liver disease. Researchers writing for the Journal of Clinical Investigation have unveiled a novel tripeptide called DT109. Asterisk the mechanism, the drug successfully attenuates metabolic dysfunction-associated steatohepatitis, MASH. Asterisk the result, it blocks ammonia derived from gut bacteria, effectively halting and reversing severe liver scarring and fat accumulation. Hashtag baby COVID lockdown, babies excel in language. A newly released study on 4-year-olds born during the 2020 pandemic lockdown shows unexpected cognitive twists. Asterisk the positives, children scored significantly higher than pre-pandemic norms in sentence structure, expressive vocabulary, and nonverbal reasoning. Asterisk the negatives, the exact same cohort exhibited noticeable difficulties in executive function, struggling with working memory, organization, and emotional self-control. Hashtag 3. Oncology and rare disease approvals. Hashtag reminder ribbon major breast and solid tumor approvals. The FDA expanded its oncology arsenal with 2 major traditional regulatory approvals earlier this week. Asterisk Rivtorpic, Gedatolisib approved by the FDA for adults fighting HR+/HER2 locally advanced or metastatic breast cancer who have progressed on standard endocrine therapies. Asterisk Retevmo, selpercatinib received full, traditional approval for adult and pediatric patients aged 2 and older dealing with RAT fusion-positive solid tumors. Hashtag Trutacna granted accelerated status. The drug Trutacna, atacicept VYMJ, has secured accelerated FDA clearance for adult patients dealing with primary IgA nephropathy. This weekly self-administered subcutaneous injection achieved a 46% reduction in proteinuria during clinical trials, offering hope against progressive kidney failure. Hashtag 4. Public health policy and structural shifts. Hashtag India's massive health overhaul. The Indian government has initiated 2 sweeping structural changes to its medical landscape this week. Asterisk National Health Research Policy 2026, the Department of Health Research launched its first comprehensive draft framework to shift India's health research ecosystem from being publication-driven to patient-centric. Public consultation remains open until July 27. Asterisk MBBS seat surge, the National Medical Commission, NMC, approved 9,911 additional MBBS seats nationwide for the 2026-27 academic cycle, pushing states like Telangana past the historic 10,000-seat benchmark. ## European Union who warns of extreme European heat. The World Health Organization, WHO, issued urgent new guidance pushing European nations to heat-proof their healthcare infrastructures. With Europe warming at twice the global average, data from just 5 nations has already revealed 10,000 excess heat-linked deaths this summer alone. Thyroid issues, pregnancy problems. Studies show that if you have an untreated thyroid disorder, you're more likely to have complications when you're pregnant, preeclampsia. You also have greater chances of a miscarriage or stillbirth. You could give birth prematurely or have a low birth weight baby. WebMD. A low-calorie diet doesn't always mean a healthy diet. Focusing on calories alone could omit nutrients that contribute to proper brain function, particularly for men, whose nutritional needs are greater. The study's researchers recognize that further studies between diets and mental health are needed. Medscape. 2 arrows. One day a boy asked the priest, "Why does pain stay in the heart for long? Why do some wounds keep hurting, even when the time has already passed?" The priest took 2 arrows. Imagine a person passing through a forest is struck by first arrow. That first arrow causes real physical pain. It is suffering that life gives us: loss, failure, betrayal, sickness, rejection, or heartbreak. The first arrow pain is unavoidable. No one can live being wounded by life at some point. Then the second arrow and said, imagine after being stuck the man picks up second arrow and drives it into himself. That second arrow is the extra suffering created by his own mind. The second arrow is when you keep replaying the pain in your mind, asking why it happened, blaming yourself, holding on anger, fear, regret, or bitterness, long after the first arrow wounds was made. Life may have hurt you once, but your thoughts keep hurting you again and again. We often cannot stop the first arrow, but we can learn not to shoot ourselves with the second arrow. Moral, kissing face. The first arrow is the wound life gives us is unavoidable. Second arrow is optional suffering caused by our reactions, often comes from our own minds, by replaying it, blaming ourselves, and refusing to let go. True peace begins when we stop feeding the wound and allow it to heal. By practicing awareness and acceptance, and reduce unnecessary suffering! Hope you liked this video. Please hit that subscribe button, smash the like button to help us beat the algorithm, and I will see you in the next update. Stay healthy. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.